Welcome to this video on metabolic syndrome, often called the silent epidemic. We will provide a comprehensive guide to recognizing, preventing, and reversing this widespread health threat. This program is brought to you by the Series of Thoughts team as part of the Health and Wellness series.
In Chapter 1, we look at the growing threat. Metabolic syndrome is quietly affecting millions, often without a single obvious symptom. Metabolic syndrome is a cluster of interconnected conditions, significantly raising the risk of heart disease, stroke, and type 2 diabetes. It affects approximately 1 in 3 U.S. adults and can go undetected until serious complications arise. This is often referred to as the, quote, domino effect. Metabolic syndrome is a group of interconnected health issues that reinforce each other. The underlying driver connecting all of them is insulin resistance, which sets off a cascade effect. Each risk factor acts like a domino. High blood pressure triggers blood vessel damage, worsening insulin resistance, which drives up blood sugar and compounds cardiovascular risk. The cascade is silent, progressive, and powerful. Chapter 2 focuses on decoding metabolic syndrome, understanding exactly what defines it, and why each component matters. The diagnosis of metabolic syndrome requires at least 3 of 5 measurable risk factors. These include elevated abdominal fat, high triglycerides, low HDL, high blood sugar, and high blood pressure. The abdominal fat factor, particularly visceral fat, is one of the most powerful drivers. These metabolically active fat cells release inflammatory chemicals that disrupt hormone balance and impair insulin signaling. Insulin resistance is the root cause. Cells stop listening to insulin, glucose accumulates in the blood, damaging organs and vessels, and ultimately driving up triglycerides and lowering HDL cholesterol. Inflammation is a silent culprit. Chronic, low-grade inflammation promotes atherosclerosis and worsens insulin resistance, creating a destructive feedback loop that accelerates disease progression. Chronic inflammation fuels plaque accumulation inside artery walls. This narrowing of blood flow dramatically raises the risk of heart attack and stroke. Chapter 3 unpacks the causes and risks. Remember, some risk factors are within your control, while others require extra awareness and proactive medical care. Lifestyle choices are factors you can control. These include weight management, dietary habits, and physical activity. Losing even 3 to 5% of body weight can significantly improve multiple risk factors simultaneously. Factors beyond your control include genetics and age. Risk increases with age and a family history of related diseases. Other conditions like PCOS and sleep apnea can also increase metabolic syndrome risk. Metabolic syndrome is a vicious cycle where conditions worsen each other. High blood pressure, high blood sugar, plaque buildup, and abdominal obesity constantly reinforce and escalate the risk to your health. This chain reaction is why metabolic syndrome is so dangerous. Each condition, like obesity, insulin resistance, high blood sugar, and high triglycerides, amplifies the next, compounding overall health risk over time. Chapter 4 covers the path to prevention and reversal, focusing on powerful, evidence-backed strategies that put you back in control of your metabolic health. The good news is that reversal is often possible, especially when caught early. Lifestyle changes are the most proven cornerstone of prevention and management. Consistent intervention can halt the cascade and prevent permanent organ damage. Heart-healthy eating means fueling your body right. Prioritize whole foods like fruits, vegetables, and whole grains. Limit harmful inputs such as saturated fats, sodium, and added sugars. Consider the DASH eating plan to lower blood pressure. Food is medicine. What you eat is one of the most powerful levers you have. A diet rich in whole, minimally processed foods directly lowers blood sugar, triglycerides, blood pressure, and body weight. Embrace the power of movement. Aim for consistency with regular moderate activity. Consult your healthcare provider for a tailored plan. Remember, small wins matter. Modest weight loss can create clinically meaningful improvements in all 5 risk factors. Managing chronic stress is crucial as it elevates cortisol, which promotes abdominal fat and worsens insulin resistance. Also, quitting smoking is one of the single most impactful decisions a person can make for their long-term health. Calming the body heals the metabolism. Stress and smoking are direct physiological contributors to metabolic disease. Addressing them is as essential as focusing on diet and exercise. Chapter 5 focuses on medical interventions and long-term management, outlining the medical tools available when lifestyle changes need reinforcement. When lifestyle isn't enough, medical support is available. Targeted medications treat high blood pressure, cholesterol, and blood sugar. Combination therapy uses medications and lifestyle changes together. For severe obesity, weight loss surgery can provide dramatic improvements. Effective treatment often requires addressing underlying conditions. These include polycystic ovary syndrome, sleep apnea, and thyroid disorders. all of which contribute to metabolic syndrome. Regular follow-up is important, starting with an initial assessment. This is followed by a 3 to 6 month check-in to evaluate progress and an annual review for a comprehensive evaluation. This ongoing partnership ensures consistent care. Your doctor is your partner. Consistent medical care is an active collaboration that enables real-time monitoring and timely adjustments to keep your health moving in the right direction. Left unmanaged, metabolic syndrome significantly raises the risk of heart disease, stroke, type 2 diabetes, fatty liver disease, and sleep apnea, alongside other health risks. Metabolic syndrome impacts the whole body, triggering a systemic cascade across the heart, brain, liver, kidneys, and hormonal systems. The earlier it is addressed, the less damage accumulates. You have the power to change your health. Metabolic syndrome is manageable and often reversible with the right interventions. Understanding your risks is the first step, so partner with your healthcare provider to build a personalized plan. Your best health is still ahead of you. Every positive choice, no matter how small, moves the needle. The path forward is clear, and you do not have to walk it alone. Take control today. Do not wait for symptoms, as metabolic syndrome is often silent. Even one elevated risk factor is enough to warrant discussion with your doctor. Start small, stay consistent, and remember, this is a journey toward a healthier life.